Hi, everybody. My name is Dr. Adam Gate from The Ohio State University. Today, we are going to be talking about an exciting abstract that was presented at the American Society of Hematology 2023 conference. I have with me Dr. Tamar Tadmor here to talk about her study. Why don't you go ahead and introduce yourself?
So, good evening, everyone. My name is Tamar Tadmor. I'm working in Haifa in Bnai-Zion Medical Center, and I would like to present our work on behalf of the Israel CLL study group.
Yeah, so I'm really excited to talk about this trial. It's a trial that, in my opinion, and my interest in Richter syndrome, I was really excited to see that it was currently underway. So this is a prospective phase 2 study of the BTKI ibrutinib plus venetoclax plus obinutuzumab for patients with Richter syndrome or Richter's transformation. And it's a really important study because patients with Richter's transformation classically have really poor outcomes. And so it's exciting to see new combinations for this disease that desperately needs new therapies. So Dr. Tadmor, why don't you go ahead and take it from here and tell us about the study?
Yes, so thank you for the introduction. Indeed, I think as a doctor who treat mainly CLL, treating CLL patient with the novel target agent, we have really changed our unmet need is for patients with Richter transformation. It is what we call a rare event of patients with CLL, which transform, and the biology of the disease transform from leukemia to lymphoma, usually to diffuse large B-cell lymphoma. And the gold standard of how to treat them is to give them chemotherapy or chemoimmunotherapy. Usually what we do is giving them the R-CHOP regimen. This is how we treat patients with diffuse large B-cell lymphoma. But as you said, the outcome is quite decimal and we need to improve it. So this is an investigator-initiated trial, what we call. So it was initiated by me and my colleague, Professor Herishano, and it is a combination of 3 drugs, chemo-free regimen, and we combine the use of obinutuzumab, which is giving in his regular schedule, with the ibrutinib, which is giving in the dose that we give usually for lymphoma, meaning 560 milligram a day. And we start the venetoclax, but we do it in a rapid ramp up because we know that the disease behavior is more aggressive and we don't want to give it a ramp up of 5 weeks. So the ramp up is only in 14 days or 15 days. So it's a rapid ramp up. It's a small study and we included patients with Richter transformation. It was open both for patient naive, meaning patients who were never treated for the Richter transformation, or patients who were already treated for the Richter transformation. And our main aim was to evaluate the response rate, meaning the overall response rate that we summarized patients who achieved complete response and partial response. And this was evaluated after 3 months, after 6 months, and after 1 year. So currently what we presented at the ASH meeting was the response of 10 patients that we were able to recruit till now. Relatively aged, the older patients, what we had, so the median age of our cohort was 76 years old, so you can appreciate that it's relatively old cohort. We had 6 patients that were treatment naive and 4 patients that had already relapsed or refractory Richter transformation. And patients were presented with the regular high risk features, meaning that 50% of them had an extranodal disease, meaning that the lymphoma involved sites other than the lymph nodes. A patient had an elevated LDH and 70% of the patient had what we call double expressor, meaning another parameter for high-risk patients. Currently, the median follow-up that we have presented was a bit longer than 9 months, actually 9.1 months. And the 3 months overall response rate was 70%, and the 6 months overall response rate was 22%.
Did so that kind of meant that a lot of patients responded to the combination, but they lost the response, so it wasn't so durable. Did you find that patients who had a CR or a complete response where you weren't able to detect a lymphoma, did those patients have a durable response, or was this loss of response mostly in those patients who had like a partial response?
Yeah, so we had 4 patients who achieved complete response after 3 months, and these were the patients that were able to maintain it. But as you summarized it, I think this is already the main message for our work, is that we were able to achieve a good response and quite rapid response after 3 months, but it wasn't maintained. So it's look like a regimen that can be used as a bridge, and then we need to look for another immunotherapy to achieve the response that will be maintained.
Yeah, so I saw you presented on 10 patients. How many patients do you plan to enroll in total?
So currently we have already 12 patients, and we closed the study last week.
Okay.
So initially we were planning to have 15 patients, but now we see that we have enough. We can summarize it. We can do the sum up after 12 patients.
Great. I know personally that I use this combination as a bridge to get somebody to more consolidation, such as an allo or CAR T cell therapy. So it's great to see that this is what the trial basically showed, that although this is not a panacea for this particular disease, it does lead to high rates of responses, which we can then use to bridge to either get somebody on another novel clinical trial or potentially CAR T or allo. So that's wonderful. What are your final thoughts for the audience?
Yeah, so we see a signal that this combination works for patients with Richter transformation, both if they were naive or if they were already treated by chemoimmunotherapy, and if they were high-risk patients. But it's not good enough. So it can be used, as I said, as a bridge. And as you said, then we need to follow and to be very active to look for all allogeneic or CAR T as following allogeneic. But this combination is the first induction for these patients.
Sounds great. Well, thanks for talking with us, Dr. Tadmor. This is exciting data, and I'm looking forward to seeing the full report when it comes out.
Thank you very much.
Thanks.